you very much for the invitation. It's my pleasure to be part of the Arab Emtech Startup Conference within this Arab Blockchain Week. Today, I'll be probably talking about something that is a bit different of most of what have been talked about during the conference, the 2 days of the conference. And I'll be talking about the use of artificial intelligence in medical care and healthcare. And I'll be talking more about how to make technology more inclusive and democratized with all the technology that we have in hands. So I'll start to talk a bit about bioinformatics and data science and artificial intelligence. I'll be quite quick on this part, and the idea is just to explain what is the domain about and how AI is an important pillar in that. So as you know, data science is the domain of study that deals with volumes of data and that we need to analyze using models and technique in order to derive meaningful information, make decisions, data-driven decisions, either for businesses or any other type of domains. It can be education and so on. So AI is a branch of deep learning algorithms that are now becoming a pillar of advanced data science with the rise of big data and all the information that is now available digitally. So bioinformatics and all this is the data science when it comes to health and biomedical research. So it's kind of the ancestor of data science, and it's a quite old discipline compared to the use of the term data science nowadays. So if we start a little bit to talk about what is the history of bioinformatics, it starts with the invention of computers in the 30s. And then we had like sometimes advances more on the biological aspects and technologies. And then we have advances on computers, mathematical modeling, and their implementation to deal with biological data. So around the 50s, we had the novel structure of DNA that is now started to become more or less something that everyone would talk about. But in the 50s, that was a big invention and a big advance in the biological sciences. And then from there, we started to talk about the genetic code and how DNA is more or less coding for everything within a living organism. Also, we had started to see the first formalism in molecular modeling, which is basically all the mathematics that can be applied to how molecules would evolve within a biological system. And we see here how these two aspects of having mathematics and computation techniques evolving alongside biological advances is a very important stuff, especially when we started to have techniques to sequence DNA molecules at a higher rate with the Sanger and the 70s. And then things a little bit more started to go quick and quicker with the first supercomputers and then the personal computers during the 90s, where everyone more or less could have a personal computer at home or at work, and the use or the analyze of biomedical or biological data started to be possible at different parts of the globe. From there, things started to really go exponentially very fast. In 2000, there were the huge 10,000 human genomes, the project Human Genomes, that has for purpose to sequence 100,000 human genomes in order to elucidate what is there in the DNA of humans and ultimately understand how things are conceived. What is the human being per se based on its genomics code. So from 2000, when this big and very ambitious project has started, People thought that with all the knowledge that would be driven from the DNA code and all the analysis that will be driven alongside using computers, we will be able to understand the mystery of the humans. 10 years later, we have realized that we had a lot of knowledge in hands, but not necessarily elucidating any mystery about how things have been created and how life has been created. So still scientists had moved forward with many things, namely personalized or precision medicine, where we can, like, based on one's genome, we would decide what treatment to give or at what doses and what is the most suitable way of curing diseases for a given patient, which would not be suitable for everyone. So that's a big advance in biology and health that was mainly based on this big advances in both computer capacities to analyze things and also all the data that come from the Human Genome Project. So now with techniques that can be applied to big data, the cloud computing, the artificial intelligence techniques that becomes more and more efficient and more adapted to different types of data. Now we're kind of reaching a place where scientific knowledge is kind of exploding, if I may say. So I'm not talking right now on COVID-19, but I'll come to the 2020 COVID-19 pandemic. So talking about how computers and the capacity to analyze things using either AI or just advanced analysis have pushed biological and biology research in order to make health and a patient health better, either through understanding how a disease is taking place, or to understand how we would best treat people and cure diseases based on each one DNA background and genome. So this is one of the biggest achievement that we now reached using bioinformatics, which is basically data science for biology. Still, before moving a little bit more forwards, it is very important to stop at this point and take a look at what have been done. All the data that we have and reached till now are data that is not representative of the whole world. So it's basically data coming from very specific regions in the world, and all the data that is coming from there is more or less biased and only valid for some models, some populations, or some categories of patients. And even with the rise of AI, that is now kind of fed with more and more data, whether it is data on treatments, data on genomes, photograph, medical imageries, in order to establish better diagnosis, better treatment, provides, like understanding how a disease is evolving in order to kind of prevent it and bring assistance to people. All these advances are still within them, including a sort of a bias that is based on all the inequalities that exist in our world. So basically what is happening is that we can have like discriminatory processes in seeing the world or in collecting the data. Like, if I can give an example, we can have biased clinical decision making simply because doctors will only be seeing patients that can go to the hospital. But there are a lot of people in this world that are not able to go to a hospital or to seek healthcare in any type of infrastructure. There is also a lot of unequal access to resources and allocation, and this is mainly visible um, between the north part of the hemisphere versus the southern parts. Like if it's a developing country, low to middle income country, or a high income country. So all these biases, discrimination, either it is intentional or not, are providing us with data that is discriminatory by itself. So the samples or the data that we will be using to derive our models and the patterns that we will be like identifying using these data will definitely be biased, and all with all the technologies or the very advanced AI models that we can construct or we can validate, we will be still having all these biases that are existing, and we will be building upon them decisions that will be given credit or like being useful for some people and not for other people. It can lead to injustices based on biased decisions that we will take through these AI models that are based on discriminatory data. So through the use of all these outputs, if we are not very aware of how data was collected and if there is any people that are left out of our models, we are more or less not achieving our goal to deriving more democratized and inclusive healthcare and decisions to be made for everyone. So although with COVID-19, we kind of saw very interesting changing in some decisions because COVID-19 was so global and have touched everyone at the same level, more or less. The fact that the transmission was global, that anything happening in China is eventually making Europe in a disastrous pandemic situation, and anything that is happening in the US will kind of have China coming back to its pandemic situation. It's had made consciousness about the One Health concept, or the fact that whenever it comes to security and to health, no one should be left behind. And this is how kind of we were able to see vaccination campaigns trying to reach out the whole world as as unequal as it has been. Still it was like one historical moment where everyone was trying to get everyone vaccine. And because this is how we saw that we cannot achieve any advances if there are people that are left out. So with this in mind, let me tell you the story of AI for HT. It's a startup that I founded early in 2020. So the idea was there before COVID-19, but it was created during the pandemic. And the idea behind is to develop e-health solutions and decision-making tool to help clinicians and medical staff enhance patient management using artificial intelligence in order to achieve inclusive access to healthcare. We are focusing on leishmaniasis, which is a neglected disease that is predominant in the tropical and southern parts of the globe, but is now spreading more in the north. So it's very neglected because most of the time is not fatal, but it's a chronic disease that causes high morbidity. It is disfigurating, and it is caused by a parasite called leishmania. So When I was working with teams developing molecular tests like those that we all know for COVID-19 based on PCRs, in order to have a low-cost diagnosis tools for cutaneous leishmaniasis that can be used by the most impacted populations in Africa, I have come across the fact that these cost-effective diagnosis tools, there are some tools that are available, but they are not available to the most impacted population because these populations are either displaced, poor, uneducated, or have limited access to healthcare and are not able to go and have a diagnosis in a timely manner. So this is why we have thought of something that can go as fast as we are now seeing the technology invading the world. Like in some parts of the world, people would have smartphones and not access to water. So the idea is, how about a mobile application on a simple smartphone, not necessarily very sophisticated phone, and through an image, we would like to have a diagnosis for cutaneous leishmaniasis amongst other diseases that we are not including within our research and development plans, with a high precision in order to make the diagnosis first, help the medical staff, not necessarily a doctor, help that patient seek the good or the necessary care. Is it leishmaniasis? Should it be treated this way? Is it cancer? Anything else? And the idea is like to go from there to make it a patient orientation tool towards treatment afterwards. So we have advanced a little bit on our research and development aspects. I'm trying. I'm not showing all the images because I know some people cannot stand to look at these images because yeah, cutaneous leishmaniasis is really a disease that will permanently damage the skin. So there is no the skin would disappear and the scars will be there forever. And sometimes it's on the hands, the foot, and most of the time it would be on the face. And this is why it is very important to fight this disease and have a good patient management for it. So we have started by like treating all the data that we have on this disease. It's a very novel collection that we have in hands. And we went to building different deep learning models in order to assess their effectiveness. And we were able to have one model that achieved up to 96% of accuracy. So from now on, we would like to validate this tool on real life data during routine diagnosis. So besides having just the technology, besides having this AI tools that should be used through mobile application, the idea behind is to be as inclusive as possible. And we have a bunch of challenges to make this happen. We need to have data that are representative of all the populations, the phenotypes, like different skin tones, the different clinical manifestations that can be different from one country to another due to the parasite species and so on and so forth. So having this data is by itself a challenge, and it needs a lot of consensual and mutual collaboration with different countries across Africa and the MENA region to achieve it. And also we would like to have our technology very simple, that any nurse or any medical staff that is not necessarily very used to use high technology or very sophisticated phones use the tool. The idea is to take a picture and have a simple message to give the diagnosis and some directions towards that person to orient the patient. We need also to take into account a lot of ethical aspects related to implementing AI for medical care, but also on data privacy, as at some point or another we are collecting patient data. We have also other type of challenges that are less from our side, but more of coming from where we would like to be deploying our tool. Like, for example, if we would like to implement our tool in Tunisia, it's going to be very different from trying to go and implementing it in Egypt or in Ethiopia or in Mali. So it's really depending on the country, because there are different legal frameworks that need to be taken into account. And we don't know how each of these markets and each of these governments, as here we are talking about diagnosis tools, so it's something that will be necessarily depending on the ministries of health in each country. So we need to like have a minimum of readiness within these governments in order to accept the use of technology, which is, it may seem like a little bit odd, but many governments today in 2022 are not yet technology ready in order to use technology, mobile apps, and so on in healthcare, which is a pity. We are also kind of trying to find a business model in order to generate profit, as the company needs to survive. But we are a social entrepreneur, an enterprise. So we are not making our patients paying for that, and we need financial solution to be adapted in order to make this working. So this is where blockchain and solution like blockchain's technology can help. As for the data part, it can help decentralizing the data and making collaboration between international organisms like WHO or different countries that are working on eradicating this disease collaborate together and have the data circulating with all the privacy and security that it can exist. Also, in one single country, we can have patient data privacy secured through this technology or using these models in order to implement privacy aspects. I am not a specialist in blockchain, and the idea is I'll be welcoming any ways that people would propose in order to have solutions that would help us with all the challenges that we are facing, either from our side as AI for HD or any other people working on in the healthcare sector. So I would like to acknowledge the whole team of AI for HD, Emna Harigua and Mohammed Mulud. Both are the people that are behind the technology that have been developed here, and our partners, Professor Murad Moknia Akhila, Fatha Lamidi, and Professor Ikram Gizani from Institut Pasteur. And thank you for listening to me.